if not hungry, should we force ourselves to try to drink the Gatorade?
No.
Okay, so
no, don't force anything.
Okay, good.
Here's one, just a little reminder. Think about this. You don't need to eat for a year. Look down, right? No meals are necessary for a year. So no forcing foods.
Okay.
It's not necessary to force any foods.
Okay.
Now, if you feel weak and tired, then have a little salt. Okay? But you do not need to force anything.
Okay.
If you're weak and tired and you call me, I will tell you, eat some more salt. Right.
Everybody says the same thing on the list of
Right. It's hard to get used to that. And when you call me, you'll often say, if you're like my other patients, I am eating salt. And I'll say, not enough. You say, you can't imagine how much salt I'm eating. And I say, it's just not enough. So it's surprising, but for you to feel energetic, you're going to need to take in a lot of salt during this week because the surgery itself is so profound. It's so powerful. It's going to cause a massive loss of salt water. And that is why when we see you next week, we expect you may be down 5 or 10 or 15 pounds. And that's 5 or 10 or 15 pounds of water coming out. And if you're down 10 or 15, that's too much. That means you haven't eaten enough salt. And instead of coming back joyful and have had a fun time and maybe gone out for the New Year's holiday or things like that, you're going to be lumpy and sad and tired. So the salt makes all the difference. Another trick is you have to eat constantly. You can't eat a regular meal. So you have to say the whole day, your job constantly while I'm sitting here is a little sip, a little nibble, constantly. Never let 5 minutes go by without a sip. If you do, you're going to get behind. Now that's not dangerous, but it just means you're going to lose the opportunity to say go out, go shopping and go have fun. It's not bad, it's not dangerous, but if you want to feel vital and alive and really happy and joyful, you need to constantly be sipping and nibbling. If you don't, it's no big deal, but you're not going to have nearly as much enjoyment this week. You're going to be more slow.
How long for the salt? Could it take?
Well, I'll tell you 2 stories. At 6 months, one of my patients called me, Dr. Rutledge, you're wonderful, thank you for the surgery, down in dress sizes. I just have one problem, they won't let me go to jazzercise. I said, beg your pardon? She says, well, I called and they would refuse to allow me back to jazzercise. I said, well, why? He said, well, I keep passing out. I said, okay. Are you drinking while you're there? She said, yeah, I drink 2 bottles of water. So we switched her to Gatorade and she stopped passing out. That's at 6 months. At 2 years, I have another story. 3 years after surgery, a woman who had surgery with me called me and she said, Dr. Rutledge, hi, this is Mrs. So-and-so, and I want to let you know that for your medical records, I had a stroke. Okay. And I said, well, hi, but no, you didn't have a stroke. And she said, well, no, I'm not calling for a diagnosis or anything, just for I'm calling to let you know that I have had a stroke. And I said, no, you didn't have a stroke. She goes, look, Dr. Rutledge, I didn't call to get in an argument. I had a stroke, I'm just calling to let you know. And I said, well, my patients really don't get strokes that I know of. I said, can you tell me about what happened? And she was very frustrated. You know, I shouldn't have approached it like that, but she said, well, I was caring for my sick mother who has been in the hospital for several months. And I said, okay. I said, tell me what you ate for breakfast the morning in which you had your stroke. She said, well, I was busy and I ran out, I didn't eat breakfast. I said, okay. And I said, what'd you have for lunch? She said, I didn't eat lunch. I said, okay, and you had your stroke about 3 p.m. in the afternoon. She goes, yeah. And I said, when they did the CAT scan, they took you to the ER? She goes, yes. And they did a CAT scan to look for brain damage and all? She goes, yes. I said, they didn't see anything, did they? She goes, well, no, they said it was a mild stroke. And I said, do you remember the manual? She goes, the manual? I said, remember how you're supposed to eat salt? She goes, oh. I said, you know, you got all worried about taking care of Mama. You have to take care of you so you have the strength to care for Mom. So you can't go all day without eating or you're going to get the weak and dizzy and you'll pass out. Okay? So back to your question, how long do you have to pay attention to salt? Forever. Now, it's not so critical in the moment to moment as today and tomorrow and the next day. But forever after, you have to pay attention during the day to take in some extra fluids and salts during the day.
Are they allowed to eat sweets?
Sure. But again, remember our guidelines for sweets. Slow, small amounts, very well chewed. What you're probably going to find is that sweets are going to taste tremendously different to you. That the sweet things are going to be too sweet. And fatty, greasy things you used to like fried chicken, pizza, sloppy joes, a greasy hamburger, all of a sudden that's going to be a little bit or maybe a bite, but a couple of bites and
I don't know why the question, we don't eat it.
okay. Well, but if you could think, do you have any rich foods that you like? Any real heavy that have a lot of fat in them to make? Any desserts or pot roast or?
Probably the worst I've ever can remember is steak.
Steak.
Yeah, but steak, a good steak or a cheap steak?
Good steak.
Okay. Well, good steak.
All right, cheap.
Yeah.
I
Well,
don't eat
if
it that often to make it happy.
well, what's your favorite meal? How about that? Can I ask that? What's your favorite dinner?
One.
No? Okay. All right, well, then you may be fine.
Salad with something. I don't, some of the meat.
Steak,
chicken
steak.
steak probably.
Steak, okay.
How about pizza?
Pizza is going to be fine, but what you're going to find if you're like most of our patients is you can have a few bites and it's going to start to fill you up and you're going to start to say, oh, I'm full and I'm satisfied. And next year, you'll be able to have a whole piece of pizza. But like today, if you wanted to, you can have if you have a craving for a bite of pizza today, you could, but you want to go real slow, really small bite, and really chew it. If you do this, you're going to be in intense, awful, terrible pain. Did you see the movie Alien where the little monster crawls out of his chest? Hi, Mama, come in.
Last question. I noticed that, I thought that's correct. We all have different number of portals.
Well, one person does. One person has a different number.
Oh.
He's our biggest guy because I couldn't reach with my instrument, so I had to add a little help.
So otherwise we have 5? Is that the
Everybody gets 5, right?
So when they feel like they not chewed enough and they're too full, and is it natural to throw up? Or
Everyone's a little different. Some people are good about paying attention to our advice, and other people are thinking about other things and they're watching TV or talking and they eat too much too fast.
Mm-hmm.
Or like you said, she said she forced down her food or her medicines. If you do that, you're likely to have some trouble. But it won't happen very often because I'm going to be there to teach you.
Well, the problem is, as far as forcing down, if I didn't force anything, I wouldn't have had anything since yesterday.
Don't force anything, don't have
I
anything.
don't want anything.
Don't eat
I don't want
anything.
anything to drink, I don't want anything to eat.
Let me,
just drink?
don't eat anything, relax.
How about drinking? Can I
You don't have to do anything.
She don't have to drink?
You don't have to do anything, she's going to be fine. When she wants to drink, then it'll be time to drink. If she doesn't want to drink, leave her alone, she'll be fine.
No, she's not bugging me. That's me. I thought I have to drink.
You don't have to do anything. The beauty of the surgery is you don't have to do anything. Now, remember that if you're a heavy person, you came stuffed with extra fluid. Okay? We predict the power of the surgery is going to take off that fluid so fast that it's going to go over to the other direction, and you're going to start to get thirsty. Okay? So you can plan on that. And when that happens, you have a little something to drink. Don't force anything.
Just so.
You don't even have to force salt if you don't want to. Just relax. Now, if you stand up and you're weak and dizzy or you feel tired, then you're behind on your salt. It's that simple. Yeah. And so then you need to, sometimes to even get, like if you're walking in the mall and you get, yeah, if you're walking in the mall and you suddenly get kind of weak and tired, if you keep a little salt packet from McDonald's, you can pour it on your hand and even lick it to get a bunch of salt in a hurry. But most of the time you're just going to be fine. All you have to do is just pay attention to our guidelines, which is really simple and straightforward, which is during the day, constantly, insofar as you feel comfortable, without a lot of forcing or fighting or anything like that, sip and nibble. Little bits constantly during the day.